Good morning and happy Halloween. Coming up today on the Morning Medical Update, Halloween safety tips, plus the number all parents should have saved in their phones. Good morning. It is Monday, October 31st. I'm Jessica Lovell. We are live inside the Dulcie Simons Jr. Family Broadcast Studio. Halloween, of course, all about the candy, costumes, and the fun. But what helps your kids stick out on the dark streets could actually put them in danger. So get your questions sent in through the links here on your screen, or you can drop them in the chat thread below. Before we get started, I just wanted to take a quick peek inside our control room today. Everyone is dressed up. We are in the spirit. I have now learned what steampunk is. From Dr. Silver. She's much cooler than me, and I needed a little education on this. You got it right away.
Yeah, so it's like this Western punk industrial type theme. So like the glasses that you have, the gears, it's like pre-technology, like industrial revolution type, but like with a Western kick to it. There's like games like BioShock that are themed.
Okay, very cool. Okay, and the reason I didn't know is because Jill Chadwick, our director, this was her, I stole her costume today. So anyway, I feel kind of hip and cool, even though I didn't know what it was. Okay, also hip and cool, and in a very, very tight onesie today is Dr. Hawkinson. Hello, good morning.
Hi, how's it going?
You don't even have a place to clip your mic, it's so tight.
I know, yeah.
Wow, okay, good looking. You're welcome. Okay, and then we have Bob the Builder inside in the house. We got Bob the Builder, wait, let's see. Where are we? There's Bob the Builder. Name is Bob. And we've got our witchy Logan. And then we have Scream, Drew Barrymore. Okay, everybody's in place today. Also in place here at the desk with us, again, Dr. Elizabeth Silver, Managing Director of the Kansas Poison Control Center here at the Health System, and cardiologist, Dr. Shannon Hoos-Thompson. Good morning. You didn't know what steampunk was either, right?
I knew the character, I didn't know what it was called.
That's why I said I've seen it, but I didn't know it actually had a formal, official name. So, okay, so Dr. Silver, I want to get to, let's just jump in right off the top. The big scare this season, different than maybe seasons past. We talk about candy and what's in it, but this year, candy looking like drugs packaged in candy boxes. Let's discuss this in detail and what parents can do and what they need to be looking for.
Yeah, so I think when we talk about, I'll go for like the overall reaching question of candy looking like medications. So that is not something new. I think that's something we've definitely dealt with a lot at the Poison Center. There's a lot of, supplements over the counter, iron tablets that can look like M&Ms and Skittles and whatnot. So there's common medications that we see all the time, and we always recommend to make sure your medications are locked up, kept separate from those so that there's no risk of children getting into that because they can't tell the difference between medication and candy. I think you're kind of going for the rainbow fentanyl that is on everybody's mind right now. And so the DEA has released some, warning statements and precautions of making sure to, watch out that this is very colorful candy. We definitely know that there's evidence of it being used to smuggle the fentanyl into the United States in the different candy boxes, and they've called them Sweet Tarts and Skittles.
Yeah, we've seen those photos laid out. Yes. How might those get in the hands of our kids?
So I can say from the Poison Center perspective in Kansas, we have seen no evidence of this actually being given to children. I say that because, well, when you look at what the drug dealers are doing, there's no financial incentive for that, and I think there has been some expert consensus kind of pushing back in that perspective. However, we also want to be very cautious because they can look alike. People who are taking the fentanyl for the purposes of having an opioid, that can get mixed up if a child gets into it. So we haven't seen that happen here at the Kansas Poison Control Center. I can at least say that much. It's not the first incidence of pills looking very colorful and looking like candy as well on the street. There's many other street drugs and medications that look very colorful. There's Xanax bars, there's MDMA or ecstasy. LSD is oftentimes in these little drops on this paper, and they'll put them on their tongue, and they have really colorful, fun faces. Spice and K2 is often sold in these really fun packaging that kind of looks like potpourri. So it's not new that a lot of these medications and drugs sold on the street are meant to kind of stand out in a way. Like, you want to be known as having this thing that stands out, and you're going for like the pink fentanyl, you're going for the blue MDMA. That's not a new thing.
Do you think it's pretty obvious if parents are looking through their kids' candy like we have always said they should be doing? Is this something that would probably be pretty obvious? Is that fair to say? If things are in packages, we always say make sure things are in packages that haven't been opened. Don't eat it while you're running from neighborhood to neighborhood. Come home, let mom sift through it, take all her favorite candies that she likes, of course. But nothing different this year as far as making sure that parents are doing what they've always done.
Yeah, I would say that's definitely the biggest advice that I always have, is to look through those medications. My actual biggest concern, because we have seen kids get into this, is edibles.
I was going to ask about gummies. That was my next question.
That is actually what we've seen in data throughout the entire United States. We've seen it at the Poison Center, of edibles getting mixed up with what kids can get. So we know there's baked goods, there's gummies. There are also specifically branded candies that are THC infused. So like, you can buy like Snickers that have THC. You can buy Nerds and Nerds Ropes. There's actually a website of Nerds Ropes that's specifically for THC infused Nerds Ropes that the box is exactly the same and the product looks exactly the same, except they like change it up. Sometimes they'll say like medicated on the top.
Of course, my next question, and you probably don't have the answer, is why is that allowed? But yeah, I mean, seems like there should be a big difference between the two. What can happen if a kid gets an edible?
So if they get an edible, there's a wide range of symptoms that we'll see.
Okay.
So depending on how much they get, the dose, and how old the child is, we'll see everything from, they'll get a little altered, confused. When we kind of think about when people get high, they'll kind of look like that. But we also want to make sure that, their vital signs are okay. So they can have changes in their heart rate. They can have changes in their blood pressure. We've had evidence of having increased heart rate, increased blood pressure, also decreased heart rate, or decreased blood pressure. It can kind of do a lot of different things. And what we're really concerned is the airway for kids. So we've had cases of, we call respiratory depression, where their breathing slows down and they might need help getting oxygen and help breathing. And so those cases have gone to the hospital. So if they do show symptoms, we always recommend that they call and get taken into the emergency department.
So let's be really clear about that. If you think your kid has ingested this, call 911, call poison control, or just take them in. What's the steps?
Depending on the symptoms.
Okay.
If you think that that they did ingest something and they're not having symptoms, then definitely call us at the Poison Center. That's 1-800-222-1222. If they're having severe symptoms, you're worried about their breathing, you're worried about their responsiveness, that's definitely a 911 call. Absolutely.
We're wanting to make sure that if we could keep that number up there, that all parents or all people have this number in their phones. So put that number, 800-222-1222. You can never go wrong making sure that that's an easy number to find.
Yep. So
Dr. Thompson, kids are going to be rummaging through candy, and it's a school night, and moms like me are constantly screaming, saying, stop eating the candy. This is the time of year I go nuts, right? But what negative effects can too much candy have on our kids?
So there's a short term and a long term. And Halloween night, you're supposed to get that sugar rush, at least temporarily, right? And how far do you take it? Well, everybody's a little bit different, but yeah, we're going to metabolize, and if you take a large amount of some sort of stimulant, which sugar is a stimulant, it actually provokes the release of adrenaline, which is epinephrine in our body. And so yeah, if you take a large amount of sugar or caffeine or whatever it is that you put into your body, especially quickly in an unusual amount for that person, you're going to see that sugar high and, oh, by the way, that sugar down. So yeah, tonight or the next couple days you may see some highs and lows above and beyond normal for our kids, but in itself that usually doesn't trigger anything long-term or problematic. That's just part of the holiday, and try to keep it in check.
Right. Okay, but what about long-term? Just the effect of sugar on our hearts?
No question. So we think about diabetes, and sugar is diabetes, and so metabolism. If long term, if you're always overstimulating that metabolism, then you are going to trigger abnormal metabolism, and your body at times will lose control of that, and ultimately lead to things like type 2 diabetes in particular, not type 1. So yeah, but that's a lifelong control. So just learning now as a child, when you go through these windows where the temptation's right in front of you to grab that big handful of candy, we get a tummy ache, we don't feel quite as good about an hour later. kind of learn the lesson, say, hey, you got to keep it in check. And so it's just a reminder to have some fun, enjoy the holiday, but it's a holiday, it's not an everyday.
It's not every day. Okay, so you're telling me I could just chill. My kids always tell me I have to chill a bit, so it's okay.
Yeah, enjoy the candy, and guess what? They'll learn their lesson, just because if you ingest too much candy and too much sugar in a short amount of time, man, that high doesn't always get you where you want to be. And that low equally is not fun to come down from. And oh, by the way, when you do it at, I don't know, parent age, maybe grandparent age, yeah, it's a lot less comfortable. So just learn the age and just kind of reinforce that when it happens and try to keep it in check in the process. And I think we can all have a great time.
Have a good time over the next couple of days. Okay, good advice. Dr. Silver, let's talk about glow sticks. They're fun. They could be great for kids holding them when they're going from house to house and crossing streets so cars can see them, people can see them. We like that. But why can they be risky?
So we've had some cases of glow sticks are one of our unique exposures that we get around Halloween. And if you're not too careful, kids that are tampering with them, or especially if they're young, they're putting them in their mouth and they break them, the contents inside can leak out. If they splash on your skin, they can be irritating. It can also be irritating, especially if they splash in your eye, like if a kid bites into it and it kind of splashes up. So we've had to send some kids in to, get some eye flushes. It can be irritating to the mouth. And so they're safe and totally fine when they're all together and they're kept in one piece, but it's, playing with them rough or like biting into them that you want to be careful.
It's worth a conversation with your kids and their friends. Hey, here are these. They're fun. They can make things more safe.
Don't break them.
But don't break them. Yeah, don't play, lifesavers with them. But and tell people again why, when we have this number, you call the poison control. Are you there to help kind of people navigate what the next step should be, if there's something that they can remedy this at home, or if they need a more higher level of care?
Absolutely. So we can kind of triage, as we call it, people depending on what that exposure is. So that's one of the things that we can do is, depending on what that is, even if you get a glow stick on you, it might be totally fine, and we can say, yep, wash it off. We'll call you back in an hour. You don't need to take that unnecessary trip to the emergency room, sit there. That can be pretty expensive for people. An ambulance ride, if they don't need to take it, that saves them hundreds of dollars, if not more. And so that's what we're there for with any type of exposure.
So that's one of your unique calls. Any other unique calls? And is it true you do just get an increase during Halloween?
Yeah, we get about 10 to 15 or so more calls during Halloween compared to the rest of the days in October. We do get a lot of alcohol or ethanol type calls, a lot of Halloween parties, so that's not really age discriminatory.
Right.
We'll get a lot of callers with symptoms from that. We get glow sticks. We do get dry ice. That's kind of one of my favorite type of exposures. So that's important to make sure that you handle dry ice appropriately if you're using it. Always have some sort of protective equipment, some sort of gloves on if you're going to handle it. Do not put it in drinks. I know it looks cool. No one should be ingesting dry ice. That can cause a lot of severe burns in the mouth and the esophagus. It's a choking hazard. It's releasing carbon dioxide, so you're getting less oxygen, and it can cause perforations and other.
You'd hope people might know that, but if they don't, very good tip.
Yes.
And for kids, yeah, that's a parents only handling.
Exactly. Yep.
Yeah, for sure. So, Dr. Hughes Thompson, we hear that phrase, oh my gosh, you scared me to death. Possible? Is it possible? Or, oh my gosh, you're going to give me a heart attack because you jumped out and scared me. Possible or no? Is that just a myth?
We're going to go with no.
Okay, a hard no on that one, I figured.
So yeah, it's a startle response, and it's a protective memechanism that our body has, and a lot of animals that you can encounter or creatures that you're seeing when you're out trick-or-treating and go around a corner and there's that cat and around. But yeah, so audible or sensory visual things are usually what would trigger that, and it does, it happens. So it's an innervation from the midbrain that goes down, and one of the organs that is innervated and reacts in that situation is to make your heart pound stronger or more forceful and a little bit faster transiently. And it's a completely normal response, and it's actually a protective mechanism, and we just take advantage of it when you go through the haunted house or down that dark alley and something jumps out, or just watching a scary movie. So it's a completely normal response, and yeah, it makes you go like that because that's just all part of the response.
That's right, and your heart, and then your heart.
That means your body's doing what's supposed to do when you have that trigger.
Okay, so it's a good sign. All right, good to know. One more reminder that you could call Poison Control at any time. They're available 24 hours a day. National number is here on your screen, 800-222-1222. And Dr. Silver, you always like to remind people that this is a no questions asked type of call. You don't let the reason that you might be calling be the reason that you don't pick up the phone, right? Tell us about that.
We've heard stories from everything. So many worried callers come in. I mean, we've had moms who've call completely panicked because they went to the bathroom and they couldn't watch their kid for 2 minutes. And I mean, we've heard all of those stories before. We've heard, crazy stories. We're not there to judge. We're there to give you the steps that you need to take to help with this exposure, determine whether it's safe that you can stay home. If you have to go in and seek medical care, we will absolutely give that information. We even sometimes call ahead so that the hospitals will know ahead of time and can get you through triage faster. So that helps as well.
So you're strictly there to help and to advise and to
Yes.
get them advice that they need to get
Yes,
to get
a lot of reassurance. We do give caregivers a lot of reassurance.
Good. But again, do
Yes.
not let that reason that you might be concerned to call be a reason that you do not pick up the phone. Always call that number if you need it. Dr. Hawkinson, Medical Director of Infection Prevention and Control. Captain America joining us with our COVID count and headlines today.
Yeah.
Good morning. Happy Halloween. How are you?
I'm good.
How are you doing over there?
I'm good. We want other people to be safe, so
Yes.
hopefully we are spreading the good message here. But right now, 22 active infections in the hospital with 3 in the ICU, 1 on the ventilator, still 20 in that recovery period as well. So overall, we have seen a decrease. For some reason, we jumped up into those low 30s for active cases. Based on the CDC website and case data, we know that cases are really plateaued right now. They have been at a steady level for the past couple weeks. So hopefully we can get our active cases going down. This is all in the face also, though, unfortunately, of increasing influenza activity with increasing hospitalizations and even 360 deaths already this year from influenza based on the CDC data, as well as within this past week a pediatric death from influenza also. But that is also with RSV that's going around. So we know that there are also other common cough and cold viruses, and so I think it is just so important, behooves everybody to get your updated booster and get vaccinated against influenza.
All right, Dr. Hawkinson, thank you. Okay, a couple headlines I want to get to this morning.
Yeah.
A study that survivors of ECMO life support, something of course we talked about a lot during the height of the pandemic, people on ECMO machines, but they had a 24% higher rate of new mental health diagnoses after discharge compared to other ICU survivors. Again, this is a new study. What do you make of that?
Yeah, I think that we have to continue to understand that, and we've heard Dr. Stites say this how many times, even before the pandemic, even when we knew people came into the ICU, there were post-ICU problems. And now ECMO is one of the highest emergencies, ICU stays. You are so severely ill. These are life-saving measures. It certainly is reasonable that you have that increased degree of other problems, probably not just physical, but also those mental health diagnoses and issues afterward as well.
So a new report also from the CDC found that many patients with severe monkeypox, haven't talked about that in a minute, they had untreated HIV and weakened immune systems. So how might that complicate treating monkeypox?
Yeah, it's still going to be vitally important that if you think that there is a case, if you're having symptoms, you see your healthcare provider. We had this concern, certainly, especially in our practice with ID physicians, of our uncontrolled HIV or our AIDS patients if they did get monkeypox, and that is why it is so vitally important to understand what is your recent history been socially. If you have symptoms, please seek out a health provider to get treated, because we know that people, and we are learning more and more about monkeypox, especially in this current outbreak, those people with weakened immune systems do have a higher risk of those severe outcomes. They are also, having more symptoms such as increased pain, and that is really a lot of the reasons why people do come to the hospital, because the pain issues are so bad. So we know that that weakened immune system just sets you up for further complications. That's why it's so vitally important to get tested early and get on that therapy early.
Doc Hawk, thank you so much. Do we have any reporters on the line today? Let's get to our community on this Halloween morning. Dr. Hughes Thompson, Lisa says she can hear her heartbeat when she's laying on her pillow. Is there something wrong with my heart, she wants to know?
So what your pillow is doing, in particular if you're laying on your left side, is it's serving like a stethoscope. It muffles, and you're in a quiet situation where you're more in tune with you instead of your surroundings, and basically just brings that heartbeat to you. And so a lot of people notice that. Some people say, hey, that's when I notice it beat, kind of your regular skip around, but in and of itself, that usually doesn't mean anything, and just, oh, by the way, it's kind of a nice be able to feel your heartbeat. So tonight, when its heart's racing after you ate all that candy and you're laying on your pillow, it's okay. Find a comfortable spot, continue to relax.
Hey, your heart's beating. That's a good sign.
Yeah.
Michaela wants to know, I have chest pain. It must be my heart? True or not true?
The chest is probably the most dynamic place in the body. You've got your esophagus running down, you've got your diaphragm moving up and down, your lungs are moving every time, and the answer is, not to mention chest wall. So the answer is chest pain. Honestly, most of the time ends up being not your heart. We obviously always want to make sure it's not. But knowing your risk, when we talk about things like diabetes, high blood pressure, if you're a smoker, have a history of heart disease yourself, let alone your family members. But yeah, so chest pain predominantly is not your heart, and your body's actually pretty good in telling you when it's something more serious, and just pay attention when it does.
Good advice. Isaac wants to know, Dr. Silver, if you know what the increase in ER numbers are, just car accidents, things like that, because we know there's an increased drinking. We know that there's a lot more people on the roads. What can you tell us about that if you do know?
So unfortunately, I do not know. All of my data that I get comes from our calls that come through to the Poison Center. I know if Dr. Thornton was here, he does work in the ED.
And that's
so
one of your,
he could have given some.
You work tight with him for sure. Okay, well, we will ask him, but safe to assume that there might be some sort of increase there, but
there's a potential.
There is a
absolutely.
potential for sure. So watch out. Sharon wants to know, Dr. Hawkinson, Captain America. It is Captain America, right?
Yeah.
Am I getting my superheroes right?
Yeah.
Okay. Gotcha. Okay, is this year's flu vaccine a good match to be able to protect us from the strains that are causing infection?
Yeah, you know, I was just looking that up. Right now, we don't have a lot of interim reports on the effectiveness of the vaccine, especially in preventing severe disease and hospitalization. It is believed the vast majority of the circulating influenza viruses right now are that H3N2. So it is believed there should be a better match this year than there was last year in the past couple of years. But again, we'll be waiting for that interim analysis.
Okay, Isaac has a question, a smart question. So it involves immune imprinting. He says, what do you make of a recent preprint which found that the new bivalent booster was no better than the original vaccines due to so-called immune imprinting? Does that mean that we'll never get ahead of the virus, even with vaccines retooled for the most recent variants?
Yeah, I don't think there's been a lot of data to support necessarily that immune imprinting, or what they also some other people have termed original antigenic sin, when you have just exposure to that first spike variant on the vaccine. But we do know that you continue to evolve your immune system to have those broad responses as well. And I think when we talk about vaccines, as was in this question, we have to understand what exactly are we talking about. Is it antibodies, T cell responses, things of that nature? So again, we are also waiting for those interim clinical studies about the vaccine, not just the immunogenicity studies that were used. Now we are waiting, since they are in arms, waiting for the data analysis on that. But at this point in time, again, you should still continue to have a very high efficacy, especially with those T cell responses, for protection against hospitalization, severe disease. But that is some of the data and the analysis that we are awaiting, is that clinical analysis.
All right, Doc Hawk, thanks so much. I want to get final thoughts from our guest today. Dr. Silver, I'll start with you. Just some parting words as we head out and have a good time tonight.
All right, parting words. I would say stick with our normal precautions that we have for Halloween safety. If you find something in your kid's candy bag that you don't recognize, something that looks tampered with, something that the label's a little off, something that just doesn't look right, don't let them have that. Investigate that. And that goes for medications that you don't recognize too.
Right.
Whether we're concerned about rainbow fentanyl, or someone's coming to visit, you have family over and you don't recognize where this medication came from. Don't take anything that you don't know what it is. Keep those medications, keep edibles, keep all of that stuff locked away and separate. And if you do have any questions, don't hesitate to call us at 1-800-222-1222.
Again, another reminder, get that saved in your phone. Dr. Hughes-Thompson, final thoughts today.
In regards to the things we've been talking about, a lot of times when you feel your heart pounding, racing, things like that, pay attention to what you're doing to your body or in your body, as well as the environment around it, because a lot of times it's kind of reactive or telling you what it's sensing. And so pay attention to that. It's usually not necessarily a sign of something's wrong with your heart, but just a sign of things are going on that maybe it's time to back off and then reassess where things are at for you. But a lot of times your heart's just trying to let you know what it's sensing, and that's your opportunity to make sure you're doing what you need to be doing.
Thank you both so much. Dr. Hawkinson, your final thoughts today.
Yeah, great discussion. It looks to be a nice night, so hopefully everybody can be out, be safe. One way of maybe enticing your kids and getting them to get vaccines is promise them candy tonight. So please, we'll just continue to endorse the fact, we know influenza rates are rising, the holidays are coming up. Get that vaccine now. It needs those 10 days to 2 weeks to really build that maximum immunity. And of course, get those COVID-19 boosters if you are due for them as well.
Dr. Hawkinson, bribe my children with candy?
Yeah, absolutely.
I've never
Bribing
heard of such
good.
a thing.
No, gets things done. Yeah.
Okay. I'll try it just once.
Yeah.
All right, I want to take one more look, though, at our friends, our teammates hanging out in the control room. Where's Bob the Builder? Hello. All right, there they are, Bob, Logan, Maggie. Thanks for literally running the show today. And anyway, that's our team. See, we have some fun around here. Okay, before we go, we wanted to share something with you. We wanted to share some news that we got on Saturday. Our team was honored with a National Academy of Television Arts and Sciences Emmy Award. This was a powerful story that we did with one of our chaplains, Kathy Riegelman. She visited with COVID patients up in the ICU, praying for them and with them, and reminding us that getting vaccinated is an act of true faith in God and in science. And we want to share it with you now. So again, thank you for watching today. Thank you for Chaplain Riegelman and the medical team for allowing us to share a glimpse of the care that they have been providing COVID patients since day one of this pandemic. Please remember, COVID is still with us, and we will see you back here tomorrow.
Good morning, Stephanie. Is this a good time to come in and pray? I think it feels different because we've been to this place before, and that brief time of hope just seems like it's been swallowed up by what we're dealing with now. And it happens so fast and so furiously. God, please gather them in your arms. Part of the way I provide care for people when I'm at the bedside and someone's dying is having to pay a lot of attention to listening, and it's not just listening to the words, but being very aware of people's nonverbal communication too. The hardest part about being at the bedside when someone is so sick is that I know my job is not to fix things. The hardest part is that ability to be present in the midst of such heaviness and such grief and such sadness, knowing that there's no magic wand to wave to make this better. Maybe this would be a good time for me to go in and have a prayer at the bedside. I think what makes it even harder with COVID is that we do have some tools to fight back against this. And if people will make use of the vaccines and masking, we might not be there at the bedside. It hurts so badly when I hear people say that they feel like God is going to protect them. I really want people to know that there are ways that God may have provided for us through science, through vaccines. Science and faith can come together beautifully to help people. I don't know how you've been doing it day after day, and gosh, what's it been, 16, 18 months now. Faith means not just taking care of ourselves, but loving our neighbors. And if we can take care of our neighbors and not spread COVID, then to me that's an act of holiness.
Coming up tomorrow on the Morning Medical Update, going deep inside the brain while the patient is awake. Why? I'm Jessica Lovell. On Tuesday, we learn more about a surgical intervention that is one of many treatments helping epilepsy patients live fuller lives. We hear from one woman on the intervention that means the most. Join us at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.